Did you know over 2/3 of women over 50 have dry eye symptoms? And it's not just dryness. Eyes can feel gritty, itchy, burning, or outright pain. Some struggle with light sensitivity, blurry vision, or a constant feeling of something in the eye. But most people, and this includes some doctors, make a big mistake in their thinking around dry eye, and this is why many suffer in silence. Hi, I'm Ruth, retired doctor turned health coach and the current chair of a dry eye charity. In this first video of a series, I'll walk you through exactly what dry eye is, how it can affect you, and why so many people get it wrong. Any opinions expressed, well, they're all my own work and not the view of the Dry Eye Association UK, nor do they constitute medical advice. Let's start with what dry eye disease actually means, because when it comes to chronic conditions, knowledge is power. We've all had dry eye after a late night or too much screen time, but for some, that feeling never goes away. That's when it becomes dry eye disease, a chronic condition that can have a significant effect on daily life. Here's where it gets slightly complicated because there are 3 different types of dry eye: aqueous deficient, evaporative, and mixed. But to understand dry eye, first you have to understand tears. Why do we have tears? Well, their function is to protect the delicate surface of the eye. The cornea is the clear dome over the coloured part of the eye, the iris, and there are more nerves in the cornea than any other part of the body. Now remember that fact because we're going to come back to it later. Because you need your cornea to see, the nerves protect it. So if you get a grain of sand in your eye, the nerves trigger the release of tears to wash it out. It's a bit like throwing a bucket of water on a fire. It's an emergency response. But the body also produces tears constantly to nourish and hydrate the eye surface. You might not know this, but your tears have 3 layers, and I'm going to explain the difference using a glass of water, and this seemed like a good idea at the time. Firstly, at the bottom, we have the mucus layer. So this is sticky and it allows the tears to stick to the surface of the eye. And it's represented here by peanut butter. And I apologise for the criminal waste of good peanut butter. Then in the middle, we have the water layer. So this hydrates the eye, but it also contains important nutrients and antibodies. And on the top, we have an oil layer, which prevents the tears from evaporating. Now these layers come from different glands. The lacrimal gland, which sits under your skull around here, produces the watery aqueous layer. There are special glands in your eyelids which sit just behind the lashes called meibomian glands, and these produce the vital oil layer. Every time you blink, these glands release oil. You can see the blobs of oil in this picture. Now we're going to go back to those 3 types of dry eye. First, we have aqueous deficient, which is a fancy way of saying water deficient. So the lacrimal glands don't make enough of the water layer. Common causes are age and the menopause. And in the menopause, hormonal changes mean that both the lacrimal and the meibomian glands don't function as well. Aqueous deficient dry eye is also common in autoimmune conditions like Sjogren's disease or rheumatoid arthritis. And refractive eye surgery, for example, LASIK surgery for short-sightedness, can damage the nerves that run between the cornea and the lacrimal glands, and this can reduce tear production. Evaporative dry eye is when you make enough of the water layer, but the tears won't stay, they evaporate. You can have excess tear evaporation from your environment, for example, windy weather, or sitting in air conditioning, or not blinking enough. When we sit in front of a computer or our smartphone, our blinking rate decreases significantly, and that's why it's really important to take breaks. Some people, myself included, don't blink particularly efficiently. So there's something called partial blinking, and this is where the upper eyelid gets halfway down the eye, basically gets a bit lazy and goes, had enough, and goes back up again. So you're not touching the eyelids together, so you're not getting that stimulus to produce and secrete oil. With time, the glands make less oil and the oil within them can become stagnant to the point of even solidifying and blocking the glands. And this is called meibomian gland dysfunction, or MGD for short, and it's really common. And less oil means more evaporation. I promise I'm done with the glasses now. And the third kind is mixed dry eye, and this is where you don't have enough water and you don't have enough oil either. And this is the type of dry eye disease that I have, because I'm special. And this, unfortunately, is where things can spiral. Whatever the cause, the end point is the same. Fewer tears lead to more concentrated and salty tears. Salty tears damage the eye surface, causing inflammation, and this further inhibits tear production. And this vicious circle is why dry eye disease is now classified as an inflammatory condition. So moving on to that big misconception. Just before we do, if you are finding this video useful, I will be really grateful if you could help me grow my small channel by hitting the like button. If you subscribe and turn on notifications, then you won't miss any of my future content. Now here's what people get wrong. Many people, and that includes some doctors, see dry eye disease as a minor condition. A bit of irritation. Even the name trivialises it. Dry eye, just use some eye drops, get on with it, yeah? But here's the truth. There's a really wide range of symptoms, and for some people, dry eye disease is life-changing. I'll say it louder for the people at the back. Dry eye disease is not a minor condition. Remember when I told you that the cornea has more nerves than anywhere else in the body? Well, that's why it hurts so much. Studies show that the impact from dry eye disease can be as bad as angina, so that's chronic chest pain from coronary heart disease. People's nerves can also differ in terms of sensitivity, so the same amount of dryness can cause different amounts of pain in different people, depending on how high the volume is turned up on those nerves. Dry eye disease affects all sorts of common activities, including going to work, reading, using a computer, and outdoor activities. In 2023, I ran a survey with 250 UK patients. 29% described their symptoms as severe or extreme. 52% think about their eyes all or most of the time. 35% have disrupted sleep, and 17% have had to change or leave their job. One patient said, "It's devastated my life." But there is hope. If your dry eye disease is mild, then great. Keep your eyes hydrated and use preservative-free eye drops. The sooner you treat it, the better. If you wear contact lenses and have dry eyes, then speak to your optometrist. And if you're struggling, then know this: you are not alone. There are treatments that work, but getting a proper diagnosis is key. I will link UK and US dry eye charities in the description. They have support groups, resources, and expert advice. There are also researchers, optometrists, doctors, and patient advocates like me pushing for better treatment and better awareness. And the fact that it is such a common condition means that there is a lot of research going on. And I'm living proof that things can improve. So essentially, my eyes cost me my career, and at one point I was housebound with eye pain, but with time, the correct treatments and some lifestyle changes, I got my life back. If you've got dry eye disease, come say hi in the comments and share this video with anyone who you might think needs a bit of help. In future videos, I'll cover diagnosis and treatment options, and you'll find it here when it's ready. In the meantime, check out this video for some frustrating menopause symptoms other than dry eye and some things you can do to make yourself feel better. So I'll see you in the next one.